Hello, I'm Hannah, a tissue viability nurse at Leicestershire Partnership Trust. You might be watching this video if you have a pressure ulcer or have been told you're at risk of developing one. In this video, we're going to discuss the importance of changing your position and show you ways it can be achieved. Repositioning is a phrase you will hear your healthcare professional use for this. If you are at risk of developing a pressure ulcer, it is recommended that you change your position every 2 hours as a minimum. However, if you are spending a lot of time sat in a chair, you may need to reposition more frequently than this. This is because when you are sat in a chair, the weight of your body squashes the tissues of your bottom. This prevents the flow of blood to the skin, causing the oxygen to be cut off there. When you are lying in bed, however, your weight is more evenly distributed across the surface, allowing the blood to flow more freely. Because of this, your health professional may encourage you to have periods of bed rest if you are at increased risk of developing a pressure ulcer. Of course, the best way to get oxygen back to your skin is to stand up, but only if you can do so safely. You may be seen by other healthcare professionals such as physiotherapists, occupational therapists, and support worker roles who may advise you on repositioning or exercises to support your pressure care needs. If you are sitting in a chair, it's recommended that you change your position as often as you can and not sit in one position without moving for more than 2 hours. You may find it useful to find something that will remind you to move, for example, advert breaks on the television or radio, setting alarms on your mobile phone, or asking friends and relatives to remind you. Let me introduce Liz. Liz is at risk of developing a pressure ulcer. This is due to recent surgery and a chest infection, which means she is less mobile while she recovers. Due to this, Liz is finding that she's spending more time during the day in a chair. There are many factors that can impact your risk of developing a pressure ulcer. Please refer to our other video, Knowing Your Risk. To reduce her risk of developing a pressure ulcer, Liz ensures that she changes her position whenever there is an advert break on the TV. This is achieved by standing up for about 2 minutes every hour to allow the blood to get back to the skin. Sometimes taking a short walk around the home if you are able. Between standing times, Liz can redistribute her weight in the chair by leaning from side to side to ensure that the skin is not in contact with the chair. You can use your hand to slip under your bottom and feel that it is free from pressure. If you have a riser recliner chair, you may also use this to tilt backwards throughout the day, whatever is comfortable for you, or raise your legs. This will redistribute your weight and change your pressure points. Riser recliners with leg raisers are also a great way of ensuring that your heels are free from pressure. However, do ensure that your calves are well supported. If you are spending a lot of time in a seated position, it's easy to forget about your heels. Your heels are a bony prominence that are also at risk, therefore it's important we ensure they are protected. This can be done by using a cushioned footstool or a stool with a pillow on it. Rest your calves on this, ensuring that your heels are floating over the edge. You may need a relative or carer to help you do this, if you are unable. You may be advised on specific exercises for your needs, or generic exercises. These can be found in the Asking leaflet. These exercises will help you strengthen your muscles, maintain your functional ability, and relieve pressure through more frequent movement. This is a demonstration of an exercise in sitting. However, we recognise that we all have different abilities and there are a variety of sitting and lying exercises within the booklet. Here you can see Jane from the community therapy team talking Liz through some exercises. You start by bending your ankle and straightening your knee so your leg is out in front of you. Hold for a moment, then lower to the floor, and then repeat on the other leg. These exercises should not cause any pain, although you may feel some stretching. There is advice in the Asking leaflet if you have any concerns about the exercises and when to stop. Liz is now in bed. Although her weight is more evenly distributed in this position, she will need to reposition every 2 hours to reduce the risk of developing a pressure ulcer, even if she is on a pressure-relieving air mattress. The best way of doing this is using a 30-degree tilt. This has been proven to help prevent pressure ulcers. 1 or 2 pillows can be used to support the head and neck, as preferred for comfort. Roll or get someone to help you roll onto your side, and a pillow will be placed behind your back, from your shoulders to the bottom of your spine. A pillow is placed to support the leg on that side, whilst ensuring that the heel is free from pressure. Another pillow is placed to support the other leg. to optimise your comfort and ensure that both heels are away from the surface. If you prefer, one pillow can be used lengthways to lift both of your heels. Liz can use her hands to check that the space around the area on her lower back is free of pressure, or a carer or relative can do this for you. The same positioning technique can also be used if you prefer to sit upright in bed. However, you may need additional pillows to support your back. If you have a hospital-style bed, you can utilise the bed controls to find a position that is comfortable for you. Here you can see the nurse using the knee break of the bed. This can be helpful in preventing you from slipping down. However, please be aware if you also have your head section raised, as this can sometimes put additional pressure on your lower back area. If you are unable to get out of bed at all, or have been advised to spend additional periods of time in bed to help reduce your risk, utilising the bed controls can be helpful in achieving a sitting position. This helps with watching TV, eating and drinking, and chatting with friends and family. If you are unable to move yourself easily in bed or rely on help from carers, it is important that slide sheets are used to reduce your risk of skin becoming damaged through movement. This is what a slide sheet looks like. Your health professional will order the correct size one for you. 2 people will need to help you to use a slide sheet. This could be nurses, carers, or relatives with the appropriate training. You will need to be assisted onto your side so the slide sheet can be put into place. It's important that the slide sheet is large enough to go under your body, including your heels, as your heels can also get injured as you're moved up the bed. The slide sheet can then be removed by taking the farthest underside corner from the sheet and pulling through and upwards. Depending on your needs, there are other ways in which slide sheets can be used to help you move in bed. This will be discussed with you following an assessment. Some slide sheets can be left in place all the time. These can be useful if you rely on just one family member to help you reposition, as they can be used by one person rather than 2. If you feel that you need one that stays in place, speak to your health professional, as not all slide sheets are the same. As part of your pressure ulcer prevention care plan, you may have been provided with some repositioning charts for either yourselves, relatives or carers to complete. The purpose of this chart is not only to support your carers' documentation, but also to help nurses evaluate your current routine. One size does not fit all. If the charts being completed show that you have long periods without repositioning, there may be other equipment or help that can be provided to reduce your risk of developing a pressure ulcer. Remember, your health professional will offer advice about how often you need to reposition. If you have any concerns, please discuss this with them at the time so they can offer support if required. Thanks for watching today. For further information about pressure ulcer prevention, please refer to our other videos or speak to your nurse or health professional.